right. Well, we have another email first, and this one says, Dr. Klein, I listen to your show almost every Sunday. He has been a pretty heavy beer drinker for lots of years, and when he goes to his physician and gets a blood test, they say that he has elevated liver enzymes. He'd like to know what you recommend to help him out with his liver, and he knows he's trying to quit with the drinking.
Okay, first things first, good move on the drinking, okay, because your body has a limited capacity really to metabolize alcohol. You know, you overdo it, you live to regret it. Well, first things first, in order to reduce the liver enzymes, to reduce the damage that's being done immediately, you take something called N-acetylcysteine, sometimes known as NAC. Now, NAC is a very, very strong antioxidant. Next to alpha lipoic acid, it's probably the strongest antioxidant. What this stuff does is it actually reduces the damage being done to the liver directly. It reduces the damage being done indirectly to the pancreas, while at the same time thins the secretions from the liver to the gallbladder, and away they go. So this stuff will knock down liver enzymes in patients with hepatitis C and in my patients that have AIDS, which is very, very interesting. So I use a ton of N-acetylcysteine in the practice, you know, to the extent where I actually go to the same company that makes the Nature Throid. Okay, they agreed to bottle NAC for me because I want it pharmaceutical strength. End of discussion. The dosage is 500 to 600 milligrams. 3 to 4 times a day. You'll see a rather dramatic decrease in the LFTs, but that doesn't substitute from having to decrease the amount of consumption. Second thing you take is called L-theanine. That's spelled Theanine. Now, theanine is also a very interesting antioxidant, but what it does is it further mitigates the damage from the alcohol. So the combination of the two is absolutely wonderful. If you're unlucky, okay, particularly unlucky, and you have inflammation of the pancreas, which is it's something you see with folks that drink too much, pancreatitis, curcumin. That's spelled Curcumin. Now, curcumin is very, very cool stuff. It's a tumor necrotic factor alpha antagonist, and it will settle down the inflammation in both the liver as well as the pancreas. And it's a wonderful combination. Now, little secret. Okay, I'm going to let you in on a little secret with regards to the alcohol. Overdoing the alcohol, knowing you're overdoing it and you can't quite do it, is in some, you may want to consider this alcoholism, and that's fine if you do. Don't care if you don't. But the fact of the matter is it's very addictive. Okay, should you have that issue, okay, there's some things that you can do to reduce this. Okay, it's kind of interesting. There's one chemical that's present in Suboxone, okay, which we use for opiate addiction, which also works very, very nicely to treat alcohol addiction. The problem is that it's in significantly higher dosages, but it does in fact work. So there's some tricks with regards to alcohol treatment that are rather new on the horizon. And acetylcysteine itself is useful for alcohol and cocaine addiction.